Tennessean.com, and we are pleased to have Governor Bill Haslam here with us, along with Darren Gordon, Director of TennCare, and Wendy Long, Dr. Wendy Long, the Deputy Director of TennCare as well. This is a meeting of the Tennessean Editorial Board, and we'll be asking a couple of questions related to TennCare, this morning's news about the Medicaid expansion in Sure, Tennessee, and also a series of other questions as well related to education, politics, and all those other things. And perhaps if we could start with an explanation, a little bit about your announcement this morning. You made an announcement about Medicaid expansion. People have been waiting for that for quite some time. Would you tell us a little bit about the crux of what this announcement is all about?
Sure. We've been working on it for quite some time. If you remember back when the Affordable Care Act was announced, it was challenged at the Supreme Court. Basically, the challenge at the time was, is the individual mandate legal? The Supreme Court kind of came back and surprised everybody and said, individual mandate's legal. What is not is forcing states to expand Medicaid, who you cover in Medicaid. And so it left every state with a decision about what they were going to do on that. We said then back 20 months ago, I said, expanding traditional Medicaid I don't think is of an interest to us in Tennessee for a lot of reasons, mainly because we have a history with this in Tennessee. TennCare was really the very first managed care plan of Medicaid back when we started it. And as such, we learned some things and went through some things that other folks didn't. We came to a position back in the Governor Bredesen's first term where he realized TennCare's taken it's squeezing out everything else in our entire budget, and we have to do something to address the cost. He worked really hard to try to address the system, if you will, but due to a bunch of consent agreements that have been made in the past and some legal requirements that Medicaid had, he couldn't do that. And so we ended up making a really difficult decision to cut 155,000, is that right?
About 170,000.
170,000 people from the rolls. Obviously a painful decision that nobody wanted to be a part of. A lot of our legislators who are here now were there then. And so there was a hesitance to expand until we knew we could do it without it wrecking the rest of our budget. And you all from time to time ask a lot of hard but good questions about why aren't you spending more money on this or why aren't you spending more money on that? And at the end of the day, the answer most of the time is because TennCare is taking more and more of our budget. So for me, I didn't want to do that until I knew we were having something that I truly thought could impact health outcomes in our state, and two, was not going to cost the state additional dollars. So we started off on this process. We've been negotiating with HHS for really since that time. That was March of 2013, I said that. It's gone really fast at times, and then it's been stuck at other times. But really, as of last week, we finally got agreement with them on how we were going to cover everything. The basics of our program are this. It'll be a 2-year pilot that we can say will be done at no additional cost to Tennessee taxpayers or impact on from our general fund. We will have 2 different plans. We'll have what's called a volunteer program. That's for people who are working now, but they're not making enough to afford their company's insurance plan. We think of the people who are eligible, and we're guesstimating here, but we think 50 to 60% of them have a job and are working, but can't afford their health insurance. So we would take the federal dollars and subsidize those folks to be in their employer-sponsored health insurance plan. What that does is 2 things. One, hopefully people who are in this condition, they don't really like bouncing back and forth between Medicaid coverage and a private insurance plan. This is a step toward, we hope you get in that employer-sponsored insurance plan and stay there. It's the same thing with TANF or SNAP benefits that go to low-income folks. So the idea is not that they would stay with those forever, but that they would eventually, that's a safety net, and they would grow out of that, and we're hoping that as well. So the first would be for those folks who have a job but can't afford their employer-sponsored insurance. We would subsidize their payment with the federal dollars. The second we're calling the Healthy Incentives Plan. It would basically there would be folks who are enrolled in Medicaid, but there would be some additional co-pays and deductibles. What the spin here is, much like, I don't know how insurance works here, but like a lot of businesses do, there would be a health savings account of such with certain ways that you could get money refunded to you where you came out of pocket with cash expenses. So if you were getting preventative screenings you could do that. If you're getting your biometrics tested, all the things that you're doing that you should be doing to look after your own health anyway, if you're doing those things, you could basically earn back any cash that it cost you. So our goal in all this is to align the incentives for the user, but also for the payer. And the piece that I want to certainly emphasize is ultimately as a country, we've got to move toward payment reform. It's never going, our country really is going to our government's going to be just a big health insurance company with an Army and Navy attached to it unless we get healthcare costs under control. And one of the ways you do that is to take providers and when you go into them for a procedure, instead of paying for everything, I'm going to pay this for my hospital bed and this for the doctor and this for the anesthesiologist and this for every Band-Aid I get and every pill I get, that we say, okay, if you're getting your hip replaced, here's what we're going to pay for that hip replacement, and then we're going to evaluate that on an outcomes-based formula. That's the way, what ultimately we need to drive to. This is a big piece, and one of the incentives for us is our providers have come to us and said, it will help us move down the path toward payment reform if you can help us with the costs that we're absorbing on all these folks who are coming into us for health care coverage that we're not getting paid for. And so it isn't a quid pro quo, if you will, but it definitely is something that they're saying, we can speed you down the path on payment reform if you will help cover these folks.
Now, during these 2 years, the federal government covers 100% of that then?
They do. So that's, if you remember in the rollout of the Affordable Care Act, it was designed that there'd be 100% coverage for X number of years, and then it would slowly work its way down to 90% coverage. So the idea is that for these next 2 years, you have 100% coverage by the federal government. In the next years, when we work our way down to 90, the Tennessee Hospital Association has agreed for the hospitals to make up any difference so that this does not cost the state any additional dollars.
How are primary care doctors taking this? And I say this because I know there's been a reluctance in the past for those to take Medicaid patients, for example.
Right.
And if they have to pay, if there's less reimbursement come those 2 years, is there an incentive for them to continue to service these people?
Darren, you want to go ahead?
Yeah, there's not necessarily less reimbursement coming to primary care providers. In fact, we're working with primary care providers to actually reward them for management of all of the patient's needs as they transition, through the health system. The patient-centered medical home, you've probably heard of that. So they wouldn't be seeing less reimbursement for those individuals. We actually, our providers in our state, we're very fortunate. We have very large participation by our providers, our primary care providers. So, unlike where you see elsewhere where that is becoming a problem, and maybe in time, I think people are projecting that may be a problem in the years ahead, but we're fortunate.
How many people are going to be covered by TennCare once this rolls out in the 2-year pilot?
So we don't know for certain. We've been estimating. We initially, when this first came out 3 years ago, Darren and his team estimated 155 to 170,000. Since that time, we've been able to track other states. We think it'll probably be something more than 200,000, but we don't. The answer is we won't know until it happens. But tracking other states, we think our projections might have been a little low. Is that?
Yeah, I think the governor said exactly right. Or another couple 100,000 at least, we think will qualify for this program. We have approximately 1.3 million people on the program today.
And is that that sort of underestimate related to the people that would qualify for employer plans but couldn't afford to pay for them? Is that a new thing that y'all discovered or not?
Yeah, I think there was a lot of estimates out there on the number of uninsured before, and the ranges were pretty large, swings of hundreds of thousands of individuals, and everyone was anticipating how many folks that would be under, that make less than $16,000 a year might avail themselves of a program like this. And looking at it, we've had our actuaries looking at other states and trying to monitor, say, well, what percentage of those folks actually did that were below that income level show up? And so that's what we're thinking. Those numbers are going to be a little bit higher than what we thought that uptake rate would be.
So that we could very easily synthesize for our audience and our readers. Could you illuminate maybe the top 3 to 5 differences in this current
Sure.
Plan versus what was originally offered?
I'll take my best guess, or my best swing at it, and then Darren can correct me. I think two things. One, the availability of people buying in the subsidy to or the voucher to buy into their employer sponsor plan. So that's a big difference. And again, we think that's good because you're combining kind of private market controls with these public dollars. I think the second would be the deductibles and copays with the chance to be reimbursed for healthy choices. A lot of people have been saying, well, y'all are talking about a plan with people having skin in the game, but the people who you're talking about don't have any skin to put in the game. They can't afford that, and which is in some cases is a valid point. But they do have the ability to make wise choices for themselves, and we've got to get to where people have the incentive to make healthy choices.
And that's the healthcare savings account.
Right.
The healthy
Right.
incentives account, yes.
So I mean, the analogy, and I gave it at the press conference, but and I actually, like I said, I stole it from Governor Bredeson's book, but he talks about, I mean, it's fair. In today's healthcare system, it's going to the grocery store, you go around, pick out what you want, the assistant manager of the store walks around with you because it's in his incentive for you to buy as much as you can. You get to the cash register and they say, thank you very much. Well, nobody can tell me that's a great system for controlling cost and distributing health care. Nobody can argue that. But that's the way it works today. So we're trying to balance that between people who, like I said, don't have the resources to pay for their own health insurance, and in many cases don't have the resources to put up a significant copay or deductible. But we have to have something that incentivizes them to make good choices, and we think this is a way to do that.
Now, for those with chronic illnesses or any other things who are already so sick coming to the system, what options are available for them?
And first of all, you know, the disabled populations are on traditional TennCare, so that's an avenue for them. So looking at these individuals that make less than $16,000 a year, those two options, they can choose either one. It will be their choice. And kind of dovetailing those two questions together, there will be a counseling for the individual when they make that choice to help them understand the pros and cons of either choosing the Healthy Incentives Program or the Volunteer Voucher Program.
So just, and Wendy, correct me if I'm wrong, currently TennCare basically covers you if you're disabled, pregnant, or children. That's who TennCare was set up to cover. And that's who, so the folks with income below 138% of the poverty level, which is $16,100 a year for an individual and $27 something for a family of three. That's the population we're talking about covered, who were never initially addressed in Medicaid.
Will the TennCare computer system also be expected to enroll and keep tabs on the new Insured Tennessee program?
Yeah.
Yeah, TennCare we always have to take care of the eligibility if we're going to be claiming any of the federal funding. So as we look at these programs, that would be no different. And we've had some conversations with the federal government about basically they have the ability on their system as well when we get to a deal where they've agreed with our waiver proposal that they would open that up on their system. And then obviously as we're building out our system, we would have to account for that as well.
Well, given the problems with your current system, what are you going to need to do to make sure it's in working order once this program gets underway?
Yeah, I think, so what's interesting, we have our system, but we still have an avenue where people are becoming eligible. And again, that avenue right now has the ability, through the federally facilitated marketplace, to allow individuals that are below 138% of poverty to come in. They don't have that turned on for Tennessee because obviously we don't have an agreement worked out with them. And that information that they get, as it does today for other eligibility, gets sent to us, and people are loaded like that.
So just to be clear, for the Insured Tennessee new enrollees, they will go through healthcare.gov to enroll?
Yes, initially.
And where will the counseling, is that in person? Is that by phone? Is that through some system?
Yeah, this is a completely new element, but we would envision it being in person. Someone helping an individual, because if you think about it, if I have a certain employer-sponsored insurance, they'd have to see what that insurance offering is versus you know, what someone else's was and talk them through the pros and cons of if you want the volunteer plan or if you want to do the healthy incentives program.
So who would do the counseling?
We'd have to contract out and bring a vendor in to do something like that. It's something we've never done before. Didn't have this option of an employer-sponsored component of our program before, but we have looked around the country at folks who have done similar things to get a sense of how we could approach it.
Maria, that's an additional answer to your question about what's different about this.
Did you model this after any other state?
No, you know, we've been talking to people all along. I think, you know, we had states like Indiana and Utah who were in the middle of I don't think actually either one of them has actually gotten approval yet, but I think we've been talking with both of them because they're they're at the same stage we are, and their plans aren't the same as ours, but it contains certain similarities. So it was helpful for us, and actually, quite frankly, it's helpful for HHS because they're dealing with a multitude of different plans, and it helped them to kind of say, well, tell us which of the different paths you're thinking about going down.
I'd also add the payment and delivery system, so where we're changing the way that we pay for services to reward outcomes too, is a component that you haven't necessarily seen as part of some of the other states are experimenting with that as well, like we are. But you know, I think as we looked at it, you know, think about how can we get that right, but then also better align the incentives with the members as well, to where they complement each other.
Is it any way similar to what Arkansas was talking about doing?
Well, not Arkansas. Basically, just took folks and basically gave them Medicaid coverage, but bought private insurance for them, which is different than this. This is not, like I said, what we're doing is either employee-sponsored insurance. They were saying, we're going to go buy you as an individual an insurance plan with the Medicaid money. What we're doing is fairly different. That's where we started. We started there, but we think where we've ended up is a lot better for the long-term system.
So is Tennessee going to be the first state that's done this with employees, or did Utah do that?
Utah hasn't, as the governor was saying, they haven't been approved yet, but they have some components of that, something similar in theirs. We've looked, there's not a big track record out there where other states have ventured to try this, so we will be one of, I guess, the early adopters in this regard.
So to clarify from the earlier statement, this expansion, you do not foresee it specifically having a budgetary impact going forward?
No, I'll be real specific. We do not think it will, and that's why that was one of the big keys for us. So initially, because of the 100%, and then thereafter, the hospitals have agreed basically by increasing their assessments to make up the cost differential for us.
And have you included legislative leaders in your conversations?
Only as of I started calling people yesterday and telling the leadership last night and telling them the specifics of this, and then we continued those conversations this morning. So we have not.
What's their reaction been so far?
You know, I think they've been like, we love the fact that it's not going to cost the state any additional dollars, and then we want to hear more details. And it's not fair for me to press them for a response at this point in time. It's a fairly complex deal, and like everything else, they're going to want to see the details.
And so I noticed that you said there was going to be a special session that you asked. Why a special session?
Well, I think this is, first of all, it's so important, and number one. Number two, it's so complex that I think we benefit from just having a focus on that for a specific period of time. And as you all know, there's a lot of other things that come up during a session, and it's just so easy to have something say, well, let's roll that to next week. Let's roll that to next week, and then pretty soon it's April. We've got 4 or 5 big things in front of us, and you know, the water's really muddy.
Has there ever been a special session of this sort before?
Yeah, Governor Bredesen did it with education, so all the things that we're discussing and talking about now were all precipitated by a special session that Governor Bredesen did in 10, is that right? I don't know if anybody else around, but I think it was in early 10 that he got the Race to the Top funding approved in a 2-week special session.
When do you plan on calling the special?
We don't know, so we're working with leadership there. You know, they basically come into session on January the 13th, is that right? Then they basically have a 2-week reorganization period set. So we're working with them to do that, and then we're trying also to come to better grips with how long a period of time should we set aside. So
would you try to do it early on?
No, we would. Yeah, thanks. We would definitely propose doing it right up front. The question is, what does right up front mean? Because, like I said, they have the 2-week, what they call it, organization period. So we're trying to figure that out.
So, Governor, are you shooting to get this up and running to get maybe the last year of 100% match? Did I hear you say
We are.
that?
We would like to. Now, we don't know. I don't ultimately know the answer to how long that match is. How long it's going to take to get that match, to get it. I mean, excuse me, to get the waiver approved. It's a fairly intricate process. So, but we're definitely trying to get it done as quickly as we can.
Has CMS reviewed this plan at all? And what is
So we've just had. They've reviewed it in the sense of we've had numerous conversations, both in person and on the phone. We have not submitted a waiver to them yet, but we will be in the process of doing that.
And what's their response been, just to
What
broad outlines?
I mean, I wouldn't be here today. They've given us, final verbal approval, I guess is the best way to put that. So. I literally we kind of got close, and then Secretary Burwell and I have had numerous cell phone conversations last week, finishing, I think, Wednesday night, and then the folks at HHS or CMS confirmed that with Darren and Wendy on Friday.
Governor, today's the last day to sign up for health care coverage in order to get coverage before January 1st. I'm assuming you're telling people to just keep doing what you
They are because I don't know how long this waiver is going to take, but it's not days and weeks. I mean, it's months. And I don't know exactly how many months it is, but yeah, I would tell people they need to keep doing what they're doing.
Again, I know you said that you've just started to work with legislative leadership, but looking at the plan as it is now, where do you see the biggest challenge could be going into the legislative session with getting the plan as it's created passed?
Yeah, I think it's this. I think there's a lot of folks, from my party who are going to say, we don't like Obamacare, we don't like the Affordable Care Act, and I would say I don't like it either. I thought it was passed in the wrong way. I don't think it addressed the cost side of health care nearly enough. But that's really not the question in front of us. The question in front of us is, what should Tennessee do about health care? And the point that I'll be making to people in my party is this. I don't hear anybody in our party saying we should do away with Medicaid. I mean, that's not the discussion on the table. Even the people who think Obamacare is the worst idea to ever hit America, they're not talking about doing away with Medicaid. What we're talking about is this is a way to do Medicaid in a way that we think works better for Tennessee. As a Republican governor, every time every year we all go to the White House, and the president's nice enough to have everybody to dinner one night, and then the next day we come and he does a question and answer just with the governors and cabinet members. It's a unique chance to ask questions, and every time the Republican governor's first question is, why don't you block grant Medicaid to us? Why don't you do that? And he always tells the reason why he won't do that. Well, part of my response to Republicans would be, if they did block grant Medicaid to us, this is sort of what we would do. This isn't exactly what we do, but this looks very similar to what we would do. And so as Republicans, we've been saying all along, we think health care should be reformed. You did it the wrong way. I would argue this is a way that begins to look a lot more like how we would do it. So don't throw out this baby with the bathwater. We think this is the right path.
And you're calling it a pilot because?
Well, because it's 2 years. I think there's an advantage to saying we're going to do this for 2 years. Folks who are worried about, well, you're saying it won't cost us anything. Let's look and see if it does. You don't know exactly how many people will sign up, and like I said, we think it'll be somewhere in the range of what we talked about, but we can't guarantee that number. That gives us a chance to have 2 years under our belt, to see if it's working, see if payment reform that we're saying is a part of this is making progress as well.
You said you reached out to the leadership. Have any of them agreed to sponsor the legislation?
No, and I didn't ask them to either. It's not fair to ask somebody to sponsor something that they haven't seen. I mean, we're not kidding ourselves. This will be this will get a lot of discussion, and we understand that. And I think it's a little hard for people to wrap their arms around.
It is. And going back to the very moment of whether to expand Medicare or Medicaid or not here. And it was sort of this broad argument, and I understand it was just at the top, that we were concerned about that funding really being here in May.
Right.
Let's say that fear comes true one day, and what happens to this, and how does that help us?
Well, I think that's a reason why we will put in our waiver if the federal funding formula changes or the hospitals back off. That's a reason for us to say stop, because we really can't have Medicaid take up more of our budget in Tennessee. I mean, it's just, you all know, and you see all the pressure it happens everywhere else, and if it does, then we've got a problem. You know, it's going to take more of higher ed money, more money away from everything else we do. And so for me, kind of a very specific non-negotiable is it couldn't take more of the state's budget. And so if it does, I'd say that's a reason we're going to say stop. We'll reevaluate at that point.
So speaking of the budget then.
Yeah.
What is your strategy? Why say 7% cuts from all the departments? I mean, I think it begs the question.
I think so. To be real clear, we're not saying we're going to take 7. We said show us what 7 looks like as well as that. And so what it really does is it forces the departments to prioritize, all right, if I'm going to cut, here's what they're going to look like kind of in descending dollar order. So Darren can go through and say, I can do this and it'll save $20 million. I can do this and it's going to save $200 million. But I'm going to put that in a shopping list, if you will, a reverse shopping list of what we hope you don't take. It's a really good exercise, number one, and number two, it helps us to understand both where the dollars would be and then the impact. The question is, doesn't 7 seem a little drastic? Is a fair one, but it also, I think, is good. It shows if we had to do that, here's the kind of cuts that we're talking about having to take. And you know, we're in discussions right now with people talking about we should cut this tax or do this. People need to understand, everybody needs to understand just how difficult our budget is. And the reality is, and it's oversimplified, but every year we get about $300 million in new dollars, about. And then just the natural increases in TennCare and BP, the education formula, are about $500 million. So, you know, we start negative 200 before you do anything, before you pay a new light bulb or give a raise or pay increased insurance costs or all those things that just go up anyway. So while people could argue 7% seems kind of drastic, we're always going to have to keep shaving the cost of how we do things. It's the way we're structured here.
So you picked 7% because it wasn't 5 or 10?
I mean, why 7 as opposed to 5 or 10? I can't give you a great formula for why we picked 7. I mean, it's obviously our hope we're not going to take 7, but we're going to have to take something. If it's 7, it's a very difficult budget, and we're really hoping we're not there. So I'm hoping we're down toward the light end. Partly a reflection of revenue, partly it's a reflection of how many cuts that people propose that everybody says, yeah, that's something we should do regardless. Just in terms of good government, we should do that one.
And speaking of revenue, I know you talked about the fact that you're not going to get the health tax repealed, at least you're going to try to avoid that discussion. Right. But what do you do now at this point in the long-term strategy? Lieutenant Governor Ramsey has talked about the gas tax increase possibly. Do you have any ideas on the table as to how you continue to balance the budget, how you continue to increase revenues perhaps in the future? So 2 things. I think that like I said, either, you know, at some point in time soon, either this year or next year, I think there'll be a bill about gas tax. Remember though, that doesn't impact general fund at all. So gas tax in Tennessee just goes toward roads, gas and diesel. That's a separate question about, do we have the right long-term system in place, and do we have the right, are we ready with the needs in terms of our infrastructure? So my point would be, it's incumbent upon us as the administration to show here's what we would do with that money if you increase the fuel tax. And then it's also, I think, important for all of us not just to increase it so that, well, that was great, but 3 years from now we're back in the same position. So we're hopefully going to have a thoughtful approach to how to do that. I honestly don't know if that will be proposed this year or next year. I don't know that. General fund revenues, I don't think you're going to see. I mean, Tennessee, the reality is, like I said, we're not going to have an income tax. Sales tax is as high as it's going to go. So there's not going to be a tax increase off of either of those. I think what we have to look at is what does drive our revenue in the state, and then how do we control costs the very best that we can.
On the education front, can you tell us where you are with the search for the new commissioner?
I hope to have somebody announced by Christmas. We're in late discussions there. Like I said, beyond that, I don't have a whole lot to say. I mean, like I said, I really hope it's somebody that we'll have by in the next week or so.
Do you have a sense as to whether it's a reformer type, or can you describe what would be the?
Well, I mean, whoever I hire is going to be somebody who matches my view of education, right? I mean, that's when you hire commissioners, you hire people that will carry out the vision that you have. And my vision of One in Tennessee is one where we say every child can learn, regardless of zip code, race, gender, background, anything. That we're committed to this idea that every child can learn. And we want to have a state where outcomes continue to improve. The reality, I deal every day with the challenge of bringing a workforce, bringing employers here who have questions about our workforce. And for me, it's somebody that understands the connection between high standards in K through 12, people getting into post-secondary education, and then being able to succeed. Right now, we're in a world where 70% of our kids that graduate in Tennessee and go to community college need remedial work when they get there. Well, that's not going to work. We're never going to get to the numbers we need there. And so somebody that has a vision of, ultimately, we're trying to prepare this person for life and for a job, and that starts in kindergarten. I had a kindergarten teacher recently that was arguing that, you know, we're expecting too much out of our kids, and she said, hey, I'm a kindergarten teacher. My job is to wipe noses and wipe butts. And pardon the bluntness, but I thought, that's not your job in kindergarten. If that's your job in kindergarten, we're not going to win. That child's not going to be prepared.
Can you talk about your search for a new economic development lead?
Yeah, so again, I hope to have an announcement in the next week or 10 days. I mean, we have, I mean, just for our sake, it's just great if everybody's on board when the first of the year comes around. You know, we've had some great success in Tennessee recently with a lot of, in the last 3 or 4 years, with a lot of job announcements, a lot of people moving here. The challenge remains economic development in some of our rural areas. So even in Middle Tennessee, we're great. You know, the ring around here is great. But as you start to get a little further than that, there's some areas that struggle a lot. So I think we're going to continue to try to figure out ways that we can focus a little bit more on the rural areas where we've lagged behind in economic growth. But I think that the good news is we do have a lot of momentum, and when you're recruiting business, perception matters. And so when companies start looking, they're kind of saying, well, where's everybody else looking? It's like, you know, trying to decide where you're going to go to school. Where's everybody else looking? You know, so that's helped us a lot in Tennessee recently.
What type of person are you looking for in that position? Private sector, government experience? You
know, ideally, you want people who have at least some government experience, but I wouldn't put that as that's not a criteria. I mean, I think ultimately you want to have somebody that can sell Tennessee and can sell why you should be here. So I think we've had really good luck with going to businesses and understanding the customer, if you will. And so if you're sitting across from somebody and we understand, like, hey, the biggest decision they make is where to invest capital. And our job is to make that decision about where to invest capital as easy as we can for him or her to choose Tennessee.
Governor Haslam, in regard to that, and I'm so fascinated by helping employers and helping employees get the employer-based coverage, what skin in the game does the employer have? Is there anything in the plan to make sure that the employers don't start cutting back on their contribution, knowing now that the federal government is going to come in and pitch in?
Well, I don't remember. This is just for folks who make up to 138% of the poverty level. So just folks who make up to 16,100. A lot of who don't have coverage now. That's the issue. That's who's not covered now. So that's there. You know, with the ACA, there's certain requirements for employers for what that insurance has to look like, or they have to pay a penalty. Now, there have been some people who have speculated that at some point in time businesses might just say, it's cheaper to pay the penalty, I'm going to pay the penalty and get out of having employer insurance. But what we're doing won't encourage them to do that because they'll still have the same requirements.
Well, in fact, some employers say we shouldn't even be in the insurance business at all.
Right.
Do you see a future for that?
Well, I don't know. I mean, it's you know, if you remember when the Affordable Care Act was first announced, a lot of people said that, like, we're better off just the penalty. I can't remember what the penalty is per employee. We're better off just pay the fine, get out of the business totally. There's a lot of talk about that. I haven't seen a lot of people moving toward that yet.
In fact, we heard a lot of talk about more freelancers, contractors versus actual employees. I don't think we've really seen that either.
There's some. I mean, I think you're seeing a lot more evidence of folks who are working, who are keeping people working less than 30 hours a week than where they're not required to do the insurance. So there is, the part-time economy has gained steam because of that.
And one thing to add, I would say that there would be, as we look at it, a minimum contribution by the employer to make that voucher work. So it isn't going to completely replace that. It's going, as the governor said, it's going to supplement that so they can purchase it.
Is this more targeted to people that maybe can have their personal insurance but need to cover their family? Is that really where the goal of this is?
Actually, remember, so it's just up to 138% of poverty. So that's $16,100 for an individual, $27,000 for a family of 3. So I think most of the folks who would be covered in that, my guess is they probably don't have insurance, period, in that case.
Are there specifics yet on what a modest pharmacy copay would look like?
Yeah, Darren, do you have?
And we already have pharmacy copays in place, so we're talking about additional cost sharing for things like inpatient, outpatient, and for non-emergency use of the emergency room. And those will be at higher levels.
So most of the copays, to be clear, are going to be when people make a choice. Like if you go to the emergency room for non-emergency use, we're going to increase your copay. Again, if you've made a decision that's not a healthy decision either for you or for the cost of the system, it's more around that, which, like I said, the pharmacy copays we already have.
And what is the current pharmacy copay?
$3 for brand and $1.50 for generic.
Governor, you're making this decision approximately a year after other governors have weighed in on the Medicaid expansion. What's taken so long? Why has this process been so lengthy?
I'm not sure that's true. I mean, if you look, there have been a lot of governors that have just either still haven't decided or are still in process. So some of the states we even mentioned today haven't actually gotten approval of their plan. I'd say it's actually taken longer than I thought it would for several reasons. One, we had to make certain we could get a proposal that fit our description and that I thought I could get past here. Secondly, if you think about HHS, in the last year and a half, they've dealt with everything from healthcare.gov to Ebola to unaccompanied minors at the border. You think about what's been in their world. It's that they've had a fairly full plate as well. So getting that chance to really continue digging down was difficult. Quite frankly, the new Secretary Sylvia Burwell has been great. She has kind of personally taken this on as a challenge to, all right, if it's the governor and I sitting down talking or having multiple cell phone conversations, we're going to do that, and we've done that, and that's one of the reasons it's finally gotten to this point.
So it's better to work with her than Sebelius?
Well, I'm not going to say that. I mean, that wasn't a reflection on Secretary Sebelius as much as, you had to have, the situation had to be right, and we had gotten to, and I'd told other people at the White House this, said, we're like a football team, we're on the 5-yard line, but we're not going to get the last 5 yards without some outside help here. Without some people saying, let's figure this out. And I think Secretary Burwell was in place at the right time and had the personal willingness to dig into it.
And the Hospital Association, I mean, that's a big part of this deal.
That's a big part of the deal as well. So the Hospital Association, those guys are in a changing world as well. I mean, you remember the Affordable Care Act meant that they lost their DISH payments, the payments that they got for taking care of indigent patients, because it was assumed these folks would all be covered. And they got left in the squeeze of, lost my DISH payment, I'm not getting covered on these people that I thought I would, and that's a difficult position. So we've been talking with them and thinking through, long term, how can you help us do this, because it undoubtedly helps them a lot in the long term.
Well, it helps them here. Will they end up having to cut similar deals across the nation in places that they act that currently they're not having to make an agreement to cover that last 10%?
I don't know. I don't know that. I don't.
But it had to go into their calculus.
Talk about HHS or the hospitals?
The hospitals. When they made that agreement with you, they have to put in their calculus that every other state's going to be interested in the same deal.
They could. Of course, I'll let Darren and Wendy, because they know 10 times more than I do. My sense is when you start talking about states' Medicaid plans, when you've seen one plan, you've seen one plan.
Absolutely.
And even when I go talk to other governors, the differences between how it works for them and how it works for us is really significant. And I don't know if...
No, I think that's exactly right. I mean, some states have used some component of working with their hospitals and their plans. I can tell you how many, but again, I think the governor's spot on. I mean, our history is different. The people we work with are different than the other states. I'm the president of the National Association. I converse with my peers quite regularly, and it's just interesting the differences, as the governor points out, just even between states that border us and our own.
On a broader scale of healthcare issues, I saw a report that came out last week about obesity rates and so forth. So Tennessee was at the bottom, maybe number 45 or so.
Yeah, so we actually went down.
And could you talk about your strategy for bettering these health outcomes? Because that was one thing that I was really interested in, is that you're going from a fee-for-service to outcomes. I know that's related to Insure Tennessee, but on a broader scale.
Well, I think that's a great, you put your finger on why I think we need to, somebody said, why are you designing something that has deductible and copays in it for folks that don't have any skin to put in the game financially? We had to figure out some way to do that. Tennessee, like I said, if you look at what's driving those healthcare rates, it's tobacco use and obesity. Okay, those are two healthcare, not totally, but mostly healthcare choices. Okay, and that's what's driving our low healthcare rates and our low healthcare ratings and our costs in our system. And so I would argue that's part of why we have to drive toward more an incentive where a system where the incentives are in alignment. We also, though, it's totally separate from the healthcare, just as a state we need to change the culture around that. I've talked about changing the culture around education. We've got to do it with healthcare. And so, we've set up our Governor's Foundation for Healthcare and Wellness, and they're talking a lot about that. They're out in the marketplace trying to get that message across. It's hard to change culture, whether it be in a company or a community, and definitely in a state, but we don't have a choice because those numbers are scary, and they actually are hurting. We talked about economic development. They're hurting our economic development efforts. I mean, that's a negative for us as people put everything on the board. That's one of the factors people look at.
Can you touch a little bit on your effort to change the culture of Tennessee residents going to college with the Tennessee Promise? 56,000 plus have signed up. How many of those do you think will actually take advantage of it, and what is your long-term?
So I think that, you see this, I really do try to spend a lot of time in schools, and you see there's just a lot of kids that go, nobody in my family ever went. That's just not a discussion we have at our house. We don't talk at all about that, so we don't talk about the ACT, and we don't talk about how do you enroll for community college. So the great thing is, like I said, out of roughly 65,000 Tennessee seniors, 56,000 have filled out the form now. A lot of those, I admit, the college guidance counselor has said, fill this out. Everybody's going to fill it out. And I realize that, and some of those kids go to the Army, and some of them will go to the University of Tennessee, and a lot of them, or wherever, MTSU, wherever, won't take the Tennessee Promise. But I know a whole lot more will. We don't know what the number will ultimately be, Maria, but we think we're prepared. The capacity question, we're just at about 65% capacity of our two-year schools right now, so we have a lot of room to move on that. But the biggest thing really is, I can't emphasize enough, just changing that culture. And the reason, we kind of piloted this program in Knox County, and the interesting thing is students have come out of that, we called it Knox Achieves, have succeeded at a better rate at community college than the rest of the population. It's mainly because we've given them an adult mentor. And again, if nobody in your family's ever gone, you don't know how that works. So you think, oh, I missed the ACT Saturday, I'm sure I can go the next Saturday. Well, or the example I give all the time is we had one of our mentors got a call from one of her students saying, I'm really excited about classes starting tomorrow, but I don't know where this building is that's MWF. And if you've been to college, it means your class is Monday, Wednesday, Friday. But if you, there's no reason you would know that. And that's not how your high school classes work. So literally having somebody that can hold your hand and walk you through what feel like easy things is a big thing.
Do you think lottery revenues long-term are going to be able to sustain both Tennessee Promise and the Hope?
Well, remember, we're not counting on the lottery revenues for the Tennessee Promise. We took the balance. There was a surplus built up in that, and used that to start an endowment for Tennessee Promise. So we're not taking any additional dollars out of the lottery for that. The reality is this. And the reason we can make the Tennessee Promise work for very little money is the gap was not that big to begin with. for most students, by the time they qualified for the Pell Grant and everything else, and community college is relatively inexpensive, it didn't cost that much. But if you're a kid who's never been, you don't know that. You don't know that the gap is real small. So the gap we're making up isn't nearly as heroic as it might look like, but it felt that way to a lot of students.
So you're going to be taking on the helm of the Governors Association. Talk a little bit about what your agenda is as it comes to whether it's healthcare, Medicaid expansion, Common Core, all those other things, and what you would like to accomplish in your term.
Sure. So the Republican Governors Association really has two roles. Its first role is to help elect and re-elect more Republican governors. At the end of the day, that's what a lot of the role is about. And so this next year, there's just 3 races. There's races in, fortunately, most of them are close neighbors of ours: Kentucky, Mississippi, Louisiana. So that's one role, is helping find the right candidates, get people elected, help them raise money. The second, though, is more of a policy role. And I think we have a unique opportunity as Republican governors in this. If you think about it, the knock on the Republican Party right now is, well, yeah, okay, great. You all are electing a lot of people, but once it gets to electoral issues, you're basically a Southern white party. You do really well with Southern white males. You get out of that, it struggles. But if you look, this past time we won governorships in Massachusetts, in Maryland, the president's home state of Illinois, in Texas. We had a male candidate run against a female. He won female voters by 10%. He got over 40% of the Hispanic vote. So a lot of the challenges admittedly facing the Republican Party, the governors are living those out every day, and we're seeing it both in the electoral side and in the policy side. And I think the advantage we have over Washington is we're actually in a position to really solve problems. And I think that's the message you hear from people.
The Common Core aspect of it, I know that name can be so divisive, but the governors were the ones who came up with this concept years ago.
The National Governors Association did that, right. So, but unfortunately, the name has become a brand that has taken on so much baggage, it's hard to recognize it anymore. And y'all have heard me say, I mean, I literally have conversations with people that are convinced that Common Core is about, the new AP history test, which doesn't have anything to do with anything except English language, arts, and math. It has to do with, my kindergartner had sex education class, and that's due to Common Core. Well, no, it's not. I mean, but it's hard for us to weave through all of that to get to the truth. So my point is, we should all be able to agree on the fact that high standard, not everybody, but most of us should be able to agree on the fact that high standards matter. So let's talk about what those are and how we adapt what we have.
Can you speak Spanish?
I took it a couple of years in school, but I would hate to have to exist on my own in a Spanish-speaking country.
Can you talk a little bit about the abortion amendment and some of what we've been hearing from Harwell and Ramsey about what might be introduced?
Right. So I think what you've heard from the Speaker and Lieutenant Governor is kind of going back to pre the Supreme Court decision in 2000 of the things that were in place there in terms of waiting periods and a few things like that. What I understand from both of them is they want to keep the legislation focused there. Whether that happens or not, I don't know, but that's clearly the Speaker and Lieutenant Governor's intent.
And do you support those 3 measures that they would have?
No, I want to see more how they're written. I want to see more how they're written, but I think there's some common sense. There's some common sense approaches to that.
And there's another specific piece of legislation floated by Representative
Right.
about mandatory ultrasounds.
Yeah, again, I haven't actually seen that legislation, and there's been some questions in other states about whether doing that was legal. I think my point would be Tennessee's at a place where other states have actually proposed laws, some of which have been struck down, and we should, I wouldn't want the legislature to spend a whole lot of time on some issue that they know is going to get struck down.
Would you flag those bills?
Well, typically we flag for a couple of reasons. If for a financial reason, like you're proposing something that has a financial impact on the budget and that's not in the budget, so you just need to know that up front. Or if philosophically we're opposed to something. So again, I'd have to see what it was. We typically save, we think the flag process is a way to give kind of a heads up, like this is something that we could veto or not sign, or this has budget impact and it's not in the budget.
Other administrations have used the, it's not our unique process.
This is another national issue. Do you have a desire to be president, and do you plan to run?
No and no. I mean, you should never just totally say no to anything, but it's really not in my plans. And I say that for two reasons. It's number one, I really do love what I'm doing now, but I didn't do this to do that. And a lot of people assume this. I mean, the minute I was elected mayor in 2003, people started saying, "Are you going to run for governor or senator?" Which is, you know, I don't think real healthy. And I think the second thing, I actually really do think you get in trouble no matter what your job is if you spend all your time thinking about the next job. And so I just never have done that. You know, there's a lot of people lining up to run in 2016. It will be a heavily contested primary on our side. We'll see on the other side what happens. But you know, there's folks right now lining up with clear intent, and I'm not doing that.
Would you encourage Senator Corker to pursue that?
I think Bob should at least think about it. I think Bob brings a unique perspective. If you think about it, he's got great insight into foreign relations. I mean, he's going to be the chair of foreign relations, which is incredibly important. He's actually been the mayor of a city and understands that. He's run a small business, or actually grew into a fairly good-sized business, and then he's dealt with the federal budget and understands those issues. That's a pretty good resume, and Bob's a practical problem-solving guy that would be good. Now, whether, as his friend, whether I'd say you should do that and go through that process, what's the right, I better be careful how I describe it, but it's an incredibly difficult ordeal that can turn you inside out. And the conversations I've had with people who've really thought about it is, can you do that and stay yourself? And it's hard. I mean, it's really hard.
Okay, given time constraints, we have about 5 minutes left for any questions.
Governor, you mentioned Senator Corker. Senator Corker and Senator Alexander have put out statements this morning saying that they're looking at the plan, but they're excited to look at this. Republican Representative Desjardins said that he was extremely apprehensive of the plan. What sort of buy-in do you think you need from federal lawmakers in order to get some of the state Republicans in the legislature to support the plan?
My sense is at the end of the day, our state lawmakers are going to make their own decision. And while they'll appreciate the view of our federal delegation and what different think tanks and other groups say, at the end of the day, they're going to try to decide, is this good for the state and good for their district? So, like I said, I appreciate those who are in support of us. I know there'll be some people who will take shots at this and say it's the wrong thing. But at the end of the day, I think, you know, this is really about 132 legislators trying to decide, is this right for Tennessee? It's a different deal. I mean, you got to get 50 votes in the House and 17 in the Senate, and those are a large majority of those folks ran. I guarantee you, they all have mailers out there saying, "I'm against Obamacare," and so our job is to show them why this is not that, and why this is separate from some of the issues that you ran against.
Governor, we want to thank you so much for your
time.
Thank you, Mr. Gordon, Dr. Long, Ms. Poe, thank you very much to the editorial board. We want to thank our audience too on Tennessean.com, and the Tennessean, and please look at the replay in a few hours. And if we have any other further questions, do you mind if we get back to you?
We're not going anywhere.
All right, thank you very much. Have a great day.
Thanks, everybody.
Thank you.